Same thing with the hormone relaxing. It over relaxes the muscles to prepare for accommodation of the baby. So they tend to relax, over relax. So causing more motion and causing pain. So when you're sleeping, you make sure you put your pillow nicely like that on the head. Okay, so how do you reach there? You're pregnant. So what you do, you find somewhere you can hold, and then you support yourself like that. Then you put your hands down like that. So it's a 90-90 roll. You see the way my hands are, it's 90, also the hip 90.
Yeah.
And then I'm not tilting on one side. So you maintain the back straight, and then you just lift your arm up like that. Okay, good.
It's your girl Felicity. Hello and what's up, good people? Welcome back to my channel. It's me, Felicity, and if you're new here, you're so welcome. Guys, keep on subscribing to my channel. Road to 200,000 subscribers. Guys, msijali mbona nakaa hivi. I know I look kind of funny. Ama msiako maternity or something like that. So I have a guest with me today. She's going to introduce herself na atawaambia why I'm like this. I haven't gotten the hang of it yet. So,
I'm Antoinette Litiama. I'm a physiotherapist. So today I'll basically deal with pregnancy, and I'm going to do back physio, mainly Lamaze, for strengthening the back, and also introducing her and preparing her for delivery. And for now, I normally work as a physio, and I work also with a gyna called Dr. Witty, and an orthopedic surgeon, Dr. Buru, and also a pediatrician called Dr. Kitui. So
So guys, so as you've heard, she's a physiotherapist.
Yeah.
So for today, what are we doing specifically? Explain.
So for today, since it's the first day we're going to do physio, I'll give her soft tissue manipulation. In a layman's language, it's called massage. So I'll work on the back and also on the lower limbs. That means the legs. Pardon my medical terms. And after that, I'll introduce her into very minor exercises that will not engage or use a lot of strength. So mainly there's back soft tissue manipulation and also back exercises and also leg exercises.
Okay.
Yeah.
So is it necessary for someone who is pregnant to do all this? It's not a necessity.
It is very necessary, and most patients and also most young mothers, when they are pregnant, all the weight shifts on the belly, and this makes the back muscles very weak. And during pregnancy, some experience mid back pain, also low back pain, and some also get hip pains concerning it's being brought by pregnancy, and it's normal because of the hormone called relaxin that makes the joints loosen, and also they make the ligaments straighten, and also so that can prepare the baby to fit into the pelvic region. So it is very necessary to do Lamaze classes because it prepares you for delivery and also prevents musculoskeletal pains like back pain after delivery. And you'll find so many patients who complain back pain immediately after they gave birth.
Plus the good thing with her, she does phone calls. She has visited us today. If you also want, you can. She also does it at her clinic.
Yes.
Which is at?
It's in 40 Suits in Upper Hill on Hospital Road, 3rd floor 301. It's called Upper Hill Physio Lab.
So I think most pregnant women prefer house calls.
Yes.
So also maybe you can tell them the prices. First to get to it.
So I like assessing the patient first. After I've assessed the pregnant mother, that's when I can give out the prices. But in the clinic, I normally charge 2,500 per session, and at home, since because of the traveling, I charge 3,500. Yeah.
Guys, so you've heard that. I know there are pregnant moms who weren't aware of all this. So as you've heard, guys, it's a good thing. Maybe you should consider it. Maybe give Antoinette a call. Yeah, so let's get to it.
Okay.
Maybe tuonyeshe like what the massage contains.
Yeah.
Inaitwa?
Soft tissue manipulation.
Well, soft tissue manipulation.
Yeah.
So let us see how it's done, guys. Stay tuned.
Okay, so we've already worked on the back, and now we're going to work on the pelvic area, mainly of the hip, and also on the lower limbs. So this comes, same thing with the hormone relaxing. It over relaxes the muscles to prepare for accommodation of the baby. So they tend to relax, over relax, so causing more motion and causing pain. So when you're sleeping, you make sure you put your pillow nicely like that on the head, starting from the shoulder, and then you'll be able to put your leg like that. This is a very comfortable position when you're sleeping. But if you're able to, if you do this, your leg will hang, okay? So you make sure you put your leg fully on the pillow so that you can support the leg. Okay, so how do you reach there? You're pregnant. So what you do, you find somewhere you can hold, and then you support yourself like that. Then you put your hands down like that. So it's a 90-90 roll. You see the way my hands are, it's 90, also the hip 90.
Yeah.
And then I'm not tilting on one side. So you maintain the back straight, and then you just lift your arm up like that. Okay, we'll do 10. And then the second one, you open your hip, and then you just lift your leg up like that. So you make sure you don't turn. Your back needs to be straight, and then you do that way.
Okay.
So let's do 1-1, okay? So that you don't strain a lot. So after you do that, that is 1. Okay? So you do it 10 times. So that is one of the exercise. The second one, just at the comfort of your house, you sit at the edge of the seat, and then also your leg needs to be 90 degrees, but it can go up to, let's say, 100. Like you see the way I've pushed my leg behind, and then you put your hands on your hip, back straight, and then you just stand as you sit. So I don't want you to do your back like that. Don't turn that way. Yeah, it's normal. But you'll find people who have back weakness, they'll do that. You'd rather do like 2 or 3 repetitions, but you do it correctly.
Yeah.
So you sit, you stand straight, and then you sit straight. Okay, and then don't go with a back. You have to control the muscles. Okay. Yeah.
So I start with this.
Yes. Good.
Position.
Yeah, that's okay. Good. That is 1. You make sure the cloth doesn't limit you. That is 2. 3. 4. Just go on. 5. 6. 7. 8. 9. 10. Are you okay?
Yeah.
Good. Now we can do the leg. So you do 1 at a time. Good. 1. So make sure you maintain the back, okay? It's not easy, but you try and keep the back straight and you maintain it. Just the legs that I want them to move. Okay? Good. Perfect. 2. Nice. 3. You just assume as if you've placed a cup full of water here. Okay. And I don't want it to fall down. Good. That is 4. Mhm. 5. You okay?
Yeah.
Good. 6. Mhm. 7. Good. 8. Nice. 9. Perfectly done. That is 10. Good. So we'll do the one on the chair. So right now, since the first day, I'm going to include weights. So, but by next week we'll be able to start with weights. Okay? Yeah. Can do that. Remember, you're sitting at the edge.
Yeah.
Good. And then legs. Then just push them a bit behind so that you can be able to stand up comfortably. Hands on your waist. And then you're standing back straight. And then you control the movement while sitting. I know. Yes, I want you on the edge. Just go forward. Good. Perfect. Yeah.
Okay.
Good. Perfect. You see, when you sit at the edge, you not fall at, you not have a tendency to fall down. That is 2. 3. Control the sitting. 4. Perfect. Yeah. 5. Good. 6. It's not an easy exercise.
Yeah.
It's easy when you see someone doing it. Good. 7. And this also helps so much with back pains when you're pregnant or even after pregnancy. 9. Perfect. And 10. That's it. So you make sure you do these exercises twice in a day, morning and evening. Okay?
Yeah.
This will be able to prepare
10
you for
each.
10 each. And then we'll progress very well because I'm not going to impact you with so many exercises. We'll have to progress slowly, okay? And then later we'll be able to introduce the weights, okay? Yeah, and then make sure you do the exercise twice in a day, morning and evening. If you don't do it, I just know. Because when I give another challenge or another exercise, you'll not be able to perform. Okay? All right. Yeah, we're done for today.
We're done.
Yeah.
Okay, that's it.
Yeah.
That was nice, by the way. Thank you so much for coming through. At least nimepata ka experience fulani. Like I felt a little bit at ease.
Yeah. And it will really help you when you're sleeping. You'll not have those body aches. Yeah. And even more so early mornings. That's when you experience so many body aches. It's normal, but it's not normal when you're pregnant. You need to work on your back and also prepare your muscles for delivery. Yeah. Okay, guys, I think that is it for this video. Thank you so much for watching, and I don't know if there's anything else you want to tell the viewers. Education is very key, and you'll find so many pregnant women. They normally have these body aches, muscle back pain and pelvic pains, and they normally think it's normal because of the pregnancy. So it is not normal. You need to seek physio review or even orthopedic review so that you can be able to strengthen your muscles and also reduce pain with physio. And it's only abnormal when you have those pelvic pain and you have too much bleeding. That's when you need to get a gynecologist who can be able to guide you through. Okay, yeah. So be acquainted with the knowledge, and these days you have Google. You can get yourself acquainted with the Google platform. Google whatever you can Google, and then with Google there's a lot of information. So you just need to know. You need to Google and then you read what is right for you. And it's not about you treating yourself. It's for you to be able to know what is happening to your body. Is it normal or is it abnormal? And after you've known whatever you've read on the platform, you now go visit a doctor. You can visit a gynecologist if you're experiencing internal issues. You can visit an orthopedic doctor. if you're having musculoskeletal pains. And after delivery, your kid, you need to give your kid proper care by visiting a pediatrician.
Yeah, guys, so you've heard all that. Thank you so much for all the information. And if you need the massage those classes, make sure to hit Antoinette up. I'll put her number hapo chini. That's it for this video, guys. I'll see you in my next. Bye.